This is a particularly important bill to me and important bill in my district. This is Infant Mortality Awareness Month, September, and it's appropriate that at this month that this bill be brought up for consideration, the Newborn Act. Newborn is an acronym. Everything in Washington seems to be an acronym. And this acronym, Newborn, stands for Nationally Enhancing the Well-Being of Babies Through Outreach and Research Now. Enhancing the well-being of babies through outreach and research now. It is so important that we give children an opportunity to live and mothers and fathers an opportunity to see their children born and have a chance. My parents lost a child at about 4 months of age in 1946. They never got over it. There are so many people who've lost children, and it's something that just stays with you forever. My particular city of Memphis, while we talked about the United States rate, we know it's too high no matter what it is and how you keep statistics. The city of Memphis has one of the highest infant mortality rates in the nation, said to be second by the CDC among the 60 largest urban areas in the year 2002. In one particular zip code in my district, 38108, in the year 2007, it's in North Memphis, a predominantly low-income African-American neighborhood. I say predominantly, it's entirely low-income African-American neighborhood. Had an infant mortality rate of 31 deaths per 1,000 live births. That's almost 5 times the nation's 2007 rate of 7 deaths per 1,000 live births, and that ranks 38108 as worse than developing nations of Iran, Indonesia, Nicaragua, El Salvador, Syria, and Vietnam in infant mortality for that year. It's an issue that is it can strike people of any race, but it's largely among racial lines, and there's a great racial disparity. The CDC has found this. The Office of Minority Health at the CDC has found that African Americans have 2.4 times the infant mortality rate than whites. That African Americans are 4 times as likely to die as infants due to complications related to low birth weight when compared to white infants. And in the CDC study, it was found that African American mothers were 2.5 times more likely than white mothers to begin prenatal care in their 3rd trimester or not receive prenatal care at all. That's where a lot of research and outreach can be done, particularly the outreach. That's why the newborn bill is so needed, and that's why my office decided to make this our top priority. My Chief of Staff, Marilyn Delahaye, my District Director, Randy Wade, and our whole team met in Memphis. Brittany Johnson, who is my Legislative Director in the area of health care, and my Legislative Director, Risha Fills. The whole office worked on the issue, and we brought it as a bill, but we also had it included in the first health care bill that, the health care bill that passed this House. And it was featured in the Speaker's bullet points about what it could possibly do for infant mortality. For this would be the largest outreach program the federal government has ever engaged in this authorization, to find answers to the problem of infant mortality. Of course, because of the situation, the politics in the Senate, and we had to go to reconciliation, there wasn't a conference committee, and this part of the health care bill wasn't included, because the Senate didn't have it and reconciliation didn't allow consideration of proposals like this that didn't add to or decrease from the budget. This is an authorization. So it didn't make it through the final phase because of what happened in Massachusetts, and that hurt us in what could be an important step forward for mothers and children. We hope that the bill will pass here today and that the Senate will pick it up. We hope Senator Mikulski or Senator Dodd or somebody will help us with it, and Senator Harkin, and see that it gets through the Senate and the authorization is approved. It'll authorize the Secretary of the Department of Health and Human Services to award 5-year-long grants to 15 municipalities or states to create infant mortality pilot programs. There are guidelines on what the practices the pilot programs may employ in their quest to lower infant mortality in the area they serve, and those include outreach to at-risk mothers, increased access to educational and clinic services for pregnant women or potential mothers and families. The language suggests each program provide infant care counseling, postpartum care, additional care for at-risk mothers, and a rural outreach program and a public education program. All of these can save monies in the long run in health care, because some of the most expensive treatment rendered is for premature babies and care in this particular ages of life. It can be very expensive, and if we can have better prenatal care and less problems, not only is it the right thing to do in every way possible, but it also saves money. It is my hope that those entities who apply for this funding will do so in conjunction with existing local, private, and not-for-profit groups that have already involved themselves in the fight against infant mortality. And there are several in Memphis that have done that. Our Governor, Phil Bredesen, and our City Mayor and then County Mayor A.C. Wharton have headed up programs in our community, and our County Mayor Mark Luttrell is continuing them. The cultivation of partnerships between local leaders is essential in order to ensure the problem is addressed in as efficient manner as possible. I introduced the Newborn Act because the number of devastating instances of infant mortality in Memphis. I hope its passage and eventual enactment will help the incalculable number of people across the country who are possibly at risk to lose a child or a grandchild in the years to come. Again, I thank Mr. Pallone and the other members, particularly Mr. Waxman, for their help in getting this bill to the floor, and I hope that we'll have the help in the Senate that the mothers and children and grandchildren in this nation deserve. Thank you, Mr. Speaker, and I yield back the remainder of my time.
The gentleman from Tennessee yields